Executive Committee meeting of November 19th, 2020 to order. Kelly, could I get a roll call, please?
Mr. Lear?
Present.
Mr. Hess?
Present.
Mr. Tholen? Mr. Byrne? Ms. Weber?
Present.
Mr. Payton? Mr. Kinzinger?
Present.
Ms. Haas?
Present.
Mr. Featherling?
Present.
Mr. Miller?
Present.
Mr. Hunter?
Present.
Mr. Eads? Mr. Wheeler? Mr. Searoy?
Present.
We have a quorum.
Thank you. I have no public comment today. Is there any public comment from the back of the room? No public comment today. Okay, and moving on to the approval of the October 28th minutes. Can I get a motion maybe from Zoom, Mr. Miller? And in the room, seconded by Mr. Kinzinger. Let's do a roll call vote just because we got more people on Zoom than we do in.
Mr. Lear?
Aye.
Mr. Hess?
Aye.
Ms. Weber?
Aye.
Mr. Kinzinger?
Aye.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Hunter?
Aye.
Mr. Eads? Mr. Wheeler? Mr. Searoy?
Aye.
Motion carries.
Thank you. Moving on to legislative, Mr. Lear, do you have anything on the legislative front?
Not at this time.
Okay, thank you. Does anybody have any legislative questions for Mr. Lear? Seeing none, we'll move to information services, Mr. Kevin Duvall. Morning, Kevin.
Give you a brief. Can you hear me?
Yes, we can.
Okay, I'll just give you a brief update so you can get on to the more pressing issues. We've been continuously working on the remote users. As you know, that we've had more and more people have to go out. We're up to about 50 laptops that are out on the various departments. We got about 10 or 15 more in the works, which is allowing the various departments to send the users home. We're also at the same time building out infrastructure to take that in account because it's things that you didn't need before. But going forward, you'll need it probably forever at some point. All of that's being paid for the grant funds that you know about that I believe you guys approved originally. Specifically, we've been working on the court system. They've been increasing their use of Zoom for the courtrooms and their specific meetings as well as the board meetings. I don't know if you have any other questions. I'm just trying to keep it brief unless you have any specific thing.
Does anybody have any questions for Mr. Duvall?
Mr. Chairman, I have one.
Sure, go ahead, Mr. Featherling.
Mr. Duvall, whatever happened to the iPad in the boardroom situation for the board members?
I believe that was declined back 4 years ago. That's not a future project.
Okay.
That would have to be something that you would bring up again with the chairman and put on. I tell you, at this time, we do not have time to be working on something like that.
Well,
the other issue I would say, because of, you know what, I'm gonna leave that and let you have conversations with the chairman, and then I'll work on based on what you guys come as make a decision on.
Okay. I just was wondering, I heard about it when I first started and I haven't heard about it since. So.
I believe that was Mr. Snipes that brought that up, and there was no monies for that, and the other conclusion was that it was going to cost more than how you normally were operating. And in addition, now that in the age of smartphones and people operating for Zoom, the need for it kind of went away. We're kind of proving that by having a board meeting with Zoom from home.
Mr. Chairman?
Yes, sir. Mr. Hunter?
Yeah. Mr. Duval, I got to pose a question. It's kind of like futuristic. In your estimation and, you know, in your expertise, you got the DNA, you know, for this technology and stuff, passed on from your dad, who was a deputy chief for the Kankakee Police Department, and he was a wizard when it came to this kind of stuff. But anyway, I got a question. In your estimation, what do you see some of the futuristic technology that maybe we don't know about that we may want to implement in the future?
One of the main things, and I have to make sure that I don't step too far because it'll be between the board or the chairman and the courts. The next big deal will be when the money is available to make that next step for the courts. The existing system they have was a giant step 10 or 12 years ago, but they have additional things that they want to have. They just have to wait for the funds to come in. That will be a big jump in the system. Luckily, the county board doesn't actually pay for it, so it doesn't come out of the general funds. You just have to prove it, the final purchase, I believe. But I believe the biggest thing to affect the county or as the courts will be when they upgrade their system, because they have things that they're in need of to work with the state of Illinois.
Okay.
I don't know if that answers your question.
Well, that's one part. Anything that may be germane to the other departments?
Planning's new project will be it'll be pretty sophisticated, what they're bringing online. Mr. Featherling, I think, works pretty closely with Delbert on that. I work on that with Delbert and their GIS to get the infrastructure ready for that, but that's more in line with what Andy was discussing with you prior to the meeting about cloud-based systems.
Yeah.
So that's going to be pretty far-reaching at that point. At some point, you may upgrade your DevNet system, which is your assessor, but that need isn't there right now. And again, it's a pandemic, so money will be tight for you guys probably for the next few years. So I don't see any dramatic jumps in the near future. But that's not my call. That would be you and the chairman's call.
Thank you so much, sir.
Anything else for Mr. Duval? Anybody in the room? Anybody on Zoom? Thank you, Kevin. I can't wait till teleporting, comes around, it'll make my life a little easier getting to and from.
Yes.
In the future, far in the future. Hope I'm around to see it. So next up is Health Department Director, Mr. John Beavis. We should give you a round of applause when you come up here, John, the way you've been working.
Good morning, everyone. I've got a few topics to touch upon, and then maybe I'll just mostly answer questions that you may have. Obviously, since the last month I've been here, in regards to the COVID update, things have changed a lot, and not for the good. Obviously, our county, our state, our country, the world is in another one of these surges that they, indicated, implicated that was going to hit us again in the fall. We knew it was coming. I had no idea it was going to be this. This is even worse than what we went through in the spring in regards to the number of cases, and now the deaths are starting to increase again too for our county. Unfortunately, I have to report that we're going to be reporting at least 3 more new ones today. In the paper yesterday, we posted on our Facebook yesterday, and I think that the Journal's going to do a story on it again today. We had a stack of papers about a foot high. We have a ruler sitting next to it. If any of you have seen it on Facebook yet, or you'll see it in the newspaper today, this would be a sheet of paper. If we got this on the fax today indicating that this is my sample and it's positive, this is one piece of paper. This stack that's a foot high represents the 3,700 new cases we've had in November alone. That's not the cases since the beginning of March. That's 7,200 now as of yesterday. With the people that we have contact tracing right now, we hired 10, we've hired 4 more. That comes out to an average of 250 new cases a day. Those individuals need to call to do the investigation on one person. Each of those cases typically has an average. I'm just saying this to let you kind of know what goes on and what's involved with this. Each of those cases My case, for example, has an average of 4 contacts that we then need to contact. So those 250 cases we get on a given day represent almost 1,000 phone calls, at least for that case, that have to be reached out to try to determine who they are, what all is involved with their life, where do they work, where have they been, where might they have gotten this. This is what we're trying to do at the health department. Each day then another, yesterday was 150, so hopefully it's going down, but Thanksgiving's coming up and that's scaring us to death too, because there's probably going to be a mini surge after that, as they're predicting with the holiday seasons. If people will listen to the messaging that we're getting out and not get tired and fatigued, they're talking about the COVID fatigue, and put aside any political views for why you should wear a mask, why you shouldn't wear a mask, what I should do, what I shouldn't do. If you would just be nice and follow the guidelines as best you can, we can try to slow this down a little bit. And move forward from there and come out of this. But right now, with the surge that's hitting our county, we've not even hit our peak yet. Maybe we just did, but with Thanksgiving, I don't know. Before I would move on to the next topic, does anyone have any conversation or questions on that?
Thank you, John. You mentioned 3,700 new cases. What are the hospitalizations at? I know you put that on your website, and I do glance at it daily just to kind of go, oh my goodness.
I'm not sure of the numbers, but I know that they're overwhelmed. We have a daily phone call. One of our staff listens in on the phone calls, and they report, how many hospitalizations they have, how many people are on ventilators, and things like that. They are taxed. I can't speak for Mr. Cambick or Mr. Schride specifically in regards to what's going on, but they're feeling this too.
Yeah.
But it's not just Kankakee County, okay? If they needed to reach out to help, all hospitals almost across the state, if you listen to the governor's press conferences, a lot of places are going through the same things we are. The rhyme or the reason as to why it's exploding like this, I don't know. It's not just the bars and the restaurants. It's not just, I see people wearing the masks. I see people maintaining social distancing. I see people, washing their hands. I see businesses such as the county, the health department, all around shutting down services for appointment only, and the numbers are still going up. Yeah. Okay, so it's not that we're ignoring this and not doing anything, but this is the wave that we're on. We have to just come together as best we can, and that's all that we're preaching at the health department, to continue to put that public health message out there, to do what you can to help protect your family, your friends, your workers. And the information about Thanksgiving, if you don't have to, don't, but don't put yourselves at risk.
Thank you for that statement. I really, that was heartful. I appreciate that. Anybody in the room have a question for Mr. Beavis?
At least
anybody on Zoom have a
I do. Mr. Featherling?
Yes, go ahead, Mr. Featherling.
Thanks. John, obviously, I'm involved in not involved, but my wife is involved in the senior housing assisted living facility, and you guys have done a great job of coming up with testing equipment for her to be able to test her patients, her residents, and her employees on a really good basis. But is there any monies available or people available to help with that testing? Because it's like overwhelming the buildings to have to do that 2 times a week, their residents. That's like 140 people that they have to test 2 times a week. So I didn't know if is there money available to send a nurse over there to help, or is something like that?
Not from the health department. No, I'm not aware. The rapid test kits, and that was going to be the next topic. I was going to kind of give an update on that. We've been able to reach out, and maybe that's one of the facilities you're talking about. is that we've got approximately 11 agencies that are either all the way through the process and have received some of those test kits, but that's straight from the federal government to the state to the health departments, and we push that out. We don't have the people or the resources to do that. Part of the agreement for the facilities that accept these rapid test kits is that they have to meet the qualifications to give them, provide the training, have the staff to do it, and be able to put the stuff into the computers so that then the state sees that those positives or negatives are in the system. We can't do that, because now we're contact tracing for people who beyond what we're supposed to be doing already. And as I said at the beginning, with my rosy first part of the statement, we're overwhelmed. We can't. I'm sorry.
Yeah. No. Also, I'd like to thank you for making it available at such a quick notice.
Well, that's the state, but yeah, and we're trying, and we were allotted, and I misspoke last month. I think I said 17,000. I apologize. It might as well be 17 million, but it's not that either. It's 1,750 a week is what we're supposed to be getting. Now, in the event that through the distribution and people reaching out to us who qualify for these, we can ask for more. The state has a lot, and they're going to continue to give them out until they run out. So if we find the need for more, we can ask for more. And obviously, our county is we're one of the, if we were a hit single, we're at number 2 as of last week. In a New York Times article, Kankakee was the second fastest cases per population in the nation at that time. We've since dropped to 15, so we're a one-hit wonder, I hope. But we can get more, and I think that we have the argument to be able to ask the state to get more because of the numbers. Our Region 7 is the highest in the state right now, but all the regions are high.
Yeah. And then I had a question about, are you doing anything special for the seniors that are in the homes and that are living on their own in apartments and things like that to make education available to them for like vitamins and exercise and moving and keep going all the time? Have you guys done anything to help people fight this, or we're just sitting along and you don't have anybody to do that?
Well, we have health educators that work with those facilities. If they reach out to us asking us for any kind of assistance or needs, we can research that to determine if that's something we can provide with what we have. Most of the time it's only going to be education. In some of the conversations that I've had, I had a meeting yesterday in regards to an outbreak at a facility. Their staff are doing great things already. Mainly what they need from us are things like the rapid test kits, or help with the contact tracing, or we're just coordinating between their agency, the health department, and the state health department who sits in on these calls to just figure out, is everything being done here that we can. Ultimately we cannot provide everything for everybody that they need to have in the pinch of a moment, but we can look out and try to find those things if it's possible. But they would have to sometimes let us know what it is they need, and we can see if we have it to get it, or if we can steer them in the direction of where they can.
Okay. Thank you very much, John.
You're
Good
welcome.
luck to you, sir. Thank you for your help.
Mr. Lear?
Thank you, Mr. Chairman. John, through Kelly, we received a Thanksgiving health safety flyer. Would that be good to suggest that board members put on their own Facebook pages and other people distribute that way?
I would encourage that. Yeah, I know that between the Healthy Business Alliance, the health department, the state, we put on our social media. We ask anyone who, if it's on there and you're friends of ours, you can share that. Feel free to. Anyone who's working with the Healthy Business Alliance, sometimes we will work together to form a message so that it's consistent, and then we put those out to them also so that they can share that. So that kind of information is being put out there, yes.
Thank you.
Mr. Wheeler?
Thank you. The key is to, when the health department puts it on their page, share it from their page, because we don't want 17 different sources of the best information, and we're all trying to point towards the health department. So when they put that flyer up on their page, then we as board members or anybody should share their page. Does that make sense?
Yeah, it makes a lot of sense.
That we want one
Thank you.
central knowledge hub, if you will, so people won't have to guess where to go.
Right. No,
Yeah.
makes total sense. So please share that health department page. Mr. Hunter, did you have something? You're muted, sir.
Okay. Got a question, and you advised us what the requirements are. You know, I sit on the Hippocrates board, and you and I had a conversation about receiving some of those rapid test kits. One of the concerns was that the reporting requirement, I know you don't have anything to do with that, and that's something that the state has promulgated regarding the data collection and reporting process. Do you know if there's any kind of way to streamline that process, or are you mandated by the state to deal with that?
I think it's pretty much a mandate is the answer I would have to give. I mean, when we were provided the kits, we were given the clear instructions that we hand out to agencies in regards to, if you want to do this and qualify, these are the 7 steps, for example, that you have to be able to do. The CLIA waiver is one. The reporting is another. Training, having somebody able to give the test, and then definitely the reporting is integral into this, because the state is wanting ultimately to know who's positive, who's negative. Just for example, if you go buy a radon test kit from the grocery store, that's between you and yourself. When you do that test kit and send it off to the lab, that doesn't have to be reported anywhere. But these test kits have to be, these samples, once they're given, have to be provided into the electronic system for the state, and the health department is not going to be able to do that. That's part of the deal of you getting it, your agency. So they are responsible for being able to do that. If that's a hang up, then ultimately that might be what prevents them from being able to do it.
Yeah, that's what was discussed at our board meeting. My final question. You mentioned that there have been 7,200 cases since March. Is that correct?
Since the beginning of the crisis, we are, as of yesterday, approximately 7,200 cases, yes.
Okay. Now, based on those numbers, have you plotted the source of the infection in terms of the locations? I don't know if you empirically, but is it grocery stores? Is it at schools? Is it at other locations? Do you have the finite data to identify the source of the infections?
The easy answer to that is no. A lot of the data that is now going into the Salesforce state's electronic system that started in July is just now beginning to glean a lot of that information out. The state has started to put some of that Salesforce metric data out on their web page, so that's available. It's just kind of tricky to find it, but if you go to their main page and on the links on the left at the very top, I think it says something about metrics for the Salesforce data, and then you can go in there and see information that provides exposure locations for data since July and outbreak. Those are two different things. So basically, the exposure, for example, is if I'm being interviewed as a positive case, then the individual is being asked to try to remember, where have I been in the last 2 weeks before I got sick? And that's pretty much going to be everywhere. I've been to a retail store, I've been to the grocery store, I may have been to 2 or 3 restaurants through takeout, or maybe I went into the indoor dining when I shouldn't have. Maybe I've been to the doctor's office, I've been to church, I've been to school, and I've been to work. Those are all exposure potential places. We have no idea where I got it. We'll have no idea where you got it. Anybody got it specifically, unless you can remember, for example, somebody coughed in your face, and maybe that's probably going to be a good spot. The other one is an outbreak, and that's where, through the contact tracing, they are able to closely put together more specifically, a number of individuals were at such and such a location, such as a wedding or a family reunion or a church gathering, or in a bar or a restaurant for that matter, and they're able to link that and kind of say statistically there is a correlation there that's possibly where it came from. Again, it's not 100% certainty. That is not something that the health department was doing before COVID, and it really hasn't started to pick up for a lot of communities until recently. As I said last month, we have hired a data analyst to start to go through our Salesforce data to see if he can put together a picture potentially of where that is, but it's really only going to be a guess. And right now I can say that I believe, and I thought I had the numbers here for the off that data, if Mr. Wheeler might be looking at it right now, but I think restaurants and bars specifically, as an example, were very low on the list in terms of being attributed to, there's a zero right now for Region 7, 0 outbreaks being attributed specifically to a restaurant or a bar. However, exposure is obviously there. If you're in one of these places and there's a lot of people and they're not wearing masks and it's, belly up boys to the bar, then there's exposure risk. But is there proof that that's where it's coming from? We don't have that information.
I lost you guys. It seems like, contact tracing is crucial to you getting that information, that data, and finding out the source. And I'm glad to hear you say that bars and restaurants, may not be the source of a lot of the stuff that's going on in terms of the infection location. But we'll just have to wait and trust the science and the data collection that you guys are involved in. So thank you for sharing that information.
Mr. Hunter, that was the $1 million question, and I think you haven't had the correct answer yet, but you're going to try to come to that answer.
We're trying. In a way, I guess what I'll say is, we're still writing this book. We're reading the book. We haven't finished it yet, so it's kind of hard to, if you're asking me to tell you what it is at the end, I don't know.
It's not your final answer. Mr. Wheeler, first.
Thank you. I was trying to find it real quick here, and I couldn't get the Wi-Fi, but to the outbreak question, the zero was bars and restaurants were zero as far as outbreak sites. The big slices of the pie were universities, factories, schools.
Exactly.
The
workplaces.
Things, or in shopping, big box, if you will. Those were outbreak sites, but to, again, infection exposure possibilities, that's where some of these other things come in. So that's just from the first round of contact tracing that the health department has entered, all the health departments in the state have entered into this Salesforce.
Right.
We want to get more specific, I think, and my question that I was going to have was, last Wednesday when we were on the call with the hospitals, I'm not sure if you were there because things were a little bit busy for you last week and this week. They had said, both hospitals said that they were dealing with things okay. They still had capacity in the hospitals. If it went up by another 100%, they didn't have capacity. The ICUs had, minimal amounts of people in them for COVID. It was, there was a majority of the people were just normal ICU, if you will. But for people that had put things off because they were afraid to go to the hospitals, because of COVID and they didn't want to catch anything. So has it changed that much in a week to where, because vents weren't being used, they were sending people home after 3 days of being in the hospital? Have we seen a week explosion?
Let me just go back with my original answer and again say, I can't speak for Phil or Chris. I asked Alicia, who's sitting in on our phone calls on the morning before I came over here, I said, what's the hospital situation like in case I get asked that question? And she said it's not good. So that I'll just leave it at that. Obviously, I think they're concerned. I would be concerned if I were in their shoes. I'm concerned in my shoes. We've got 2 hospitals But with the increased caseload, I think a number of more people are beginning to go to the hospitals and or either through testing or being sick are starting to be admitted. Where they're at exactly on capacity, I'm not sure. The state's metrics yesterday showed we were in the pink and not the green anymore, but we were very close, which means we're sort of what your answer was from last week's phone call. I would guess it's not improved since last week, but how much more worse it's got, I really can't say. They would need to be the ones to say where they're at.
Well, your website does update the hospitalizations daily, and I
Right.
will note that. So if we need to know that number, it'll probably be on later today.
But in regards to
about
what
3.
that means in the scheme of their life, are they overwhelmed, are
Right.
they overloaded, are they out of beds?
Right, we
I
don't know what the number
I don't
is.
know.
Mr. Lear.
Thank you, Mr. Chairman. The question of where the infections come from is obviously key. The information in terms of data gets very confusing, but my understanding was that outbreak cases represent a much smaller fraction than community spread. At one point, I believe I read in DuPage County, they published some statistics that was based on 15% of their cases were outbreak related, and that would mean 85% were community spread. If that's true, then the 85% just means we really have very difficult time deciding where people get exposed. Would that be accurate?
I believe that would be a very accurate statement. With a virus and any kind of an illness like this, it's easily spread. You know, you touch a doorknob, and you have it after you've just sneezed, and then I walk through the door and touch the doorknob and then scratch my nose, and in 3 days I've got it. That's how simple. You go into the grocery store and grab the handle on the shopping cart. That's why, you know, if anything, this has shown over the past 9 months how important it is to clean, sanitize, wash your hands, potentially wear a mask to help reduce risk. These are all things we could have, should have been doing years before COVID. Lots of countries have been doing it. We're learning as we go along. So it's possible maybe the reduction in flus at this point, not making any predictions there, but there hasn't been a lot of flu yet. It's maybe because we're doing such a good job trying to protect ourselves against COVID, which is then helping prevent the risk of the flu and some of these other viruses too. However, there's a, illness. This is the cold and flu season as we start to get cold and lock ourselves inside again. And then, here's Thanksgiving and here's Christmas and school break. People are going to get together from flying all over the country, bringing their germs, my germs, all our germs. We get together and then we go back to where we go, which is why typically in January you start to see a surge in flu cases and then it goes down again. With COVID, this is a different animal, but hopefully following these guidelines will help us. But you're right, a virus, it's touching this could give it to me right now.
Mr. Payton.
Yes, sir. John, based on a community like mine, Pembroke, that I represent, does the number exceed the norm out there?
I'm not sure what the numbers are out there. Specifically for Pembroke. I can go back and look. I think that we do have data on the website that indicates cases per zip code, and we might be able to see that. If we understand or see a need for, that there's an outbreak occurring or a number of cases above what we've just been experiencing, we can reach out to community members, leaders, and try to see if we can get, we've gone out there for testing and things like that. I'm not aware more recently that anyone's really been reaching out for anything above and beyond that, but we are looking at all communities to try to deal with those kinds of things, and especially as we start to plan for, the vaccinations that will be coming down the road.
Right.
Mr. Chair.
You're going to see I
gotta
don't have
follow up,
any easy
Sam?
answers.
You got to follow up?
I just want to say, if you research and find that information, that would be helpful to me to inform the community. I would appreciate it.
It's on, if you go to the health department website, and I don't know, I did it one time, that you can search by the zip code out there, and it'll kind of give you a rough number of how many positive cases you've had in your area. Any of us can check that. I think all throughout the state, isn't it?
Yeah.
All throughout the state, you can check by zip code.
Yeah.
But it's sometimes a confusing factor to find that data to get down to it. But
If you aren't aware of, if you go to our website and the KankakeeCountyHealth.org and click on that, the first box that pops up is going to be information about COVID. And if you go click into that box, you're going to get all the information from the state, from us, from local, links to get to the Healthy Business Alliance. That's where all that information is at.
Okay.
There is tons of information there that gets updated as quickly as possible. Some of it daily, some of it weekly, but a lot of that information about zip codes and male and female, race and numbers and deaths and that kind of a thing, is links are there, and it gets updated. And so that's where it's difficult sometimes. I don't even go in there necessarily to know, everyone here is going to ask me 20 different questions from 20 different statistics that are within there. I don't follow all of that specifically myself, but it's being inputted in there. It's a great resource, and once you learn how to use it, then I just encourage you to share that to any of your constituents that call up, or your friends on Facebook, or anything like that. So whenever we post something, for example, I know I don't have a big friend base, but I hit share and it goes out to all of them.
Sure.
Some people have hundreds of people,
Right.
and it goes out to all of them.
Thank you.
thanks, Sam. Mr. Featherling, did you have something a second time?
One more for John. Something, the kind of number I like to get out there, because I get asked frequently and I'm not knowledgeable on it like you would be. Is it like 100 times more contagious than the flu, or 50 times more contagious than the flu? I mean, can you give me is there a number that you guys talk about behind the door over there? Or?
Is there a number?
That's a trick question.
Yeah, I don't know if you'll get his final answer.
First of all,
here.
if I'm talking about it behind the door, I can't talk about it in front of the door.
Okay. You know what I
No,
mean.
but actually,
what's the rumor out there for you guys? What's the rumor for you
It's
guys?
bad.
What do you think?
it's.
10
I
times more?
don't have a specific number, but just in talking to some doctors recently, we had our Board of Health meeting last week. One of the conversations that I had is that it appears to be at this point maybe more contagious than it was in the spring. Maybe a little less lethal. Maybe the virus is mutating here a little bit. That doesn't mean it's not lethal. It's still killing people. But we are seeing more and more cases, but the percentage of cases that have gone up it's not necessarily reflective in the deaths, but any new death. And I'll just say that from a personal standpoint, yesterday I found out my cousin's wife's dad passed away yesterday from COVID. Now, they live in another state, but he had just been contracted with it. They actually had a good day yesterday. They reported that he was feeling better, and then all of a sudden he turned and he passed away. So it's impacting even me.
Okay. Thank you, John.
And I, I'm just a bus guy, and I'm no scientist, but there was a big event here on November the 3rd this year that a lot of people went out to. So that could have contributed some way into the numbers that we're seeing today, and hopefully after that passes, we'll get through this little wave and won't have an event. But I know a lot of people were out and about on November the 3rd. So
God willing, we'll be okay.
and it has affected. Well, that's a sign, isn't it?
We on generator?
and I think in any shape or form, it's fairly to say that it has affected everybody.
We lost the audio.
Okay. We had a power flash here. Yeah, hold on one moment. The man out of the back of the room. Had a power flash or surge or something? They said
Somebody must have kicked the cord.
Shake it.
Our power just must have surged in the building because my lights flickered and my stuff went off. But since I do Zoom on my phone, it didn't really impact my Zoom call.
Yeah, I think we had a
very windy outside.
Power surge or something. Hopefully the power stays on.
I think my kid almost blew away today.
Generator
when I was
kicks
walking
in.
outside.
But I was trying to say that I think in fairness, COVID has affected all of us in some way, shape, or form, and that I would encourage anybody watching this video and everybody participating in this meeting to please continue to social distance, wash your hands, wear a mask, and do what's best for your neighbor. That's all I'll have to say. And John, do you have anything else?
I concur. You know,
Anybody there still?
each agency is, as Todd is saying, is dealing with this. We're doing the best that we can at the health department. We will continue to do
It
that.
just
We'll
seems
push
like
out
the
the public
boardroom
health
feed is-
information.
Yeah, Mr. Featherling, this has been, I'm on the second right now. I run off my laptop, so it's got a battery backup, and everything.
Yeah.
I had to switch over to my jetpack for internet, so I don't know if our
It must
router
be
went down.
Yeah, Ben, I'm on my phone. Jason just ran out, so maybe they know. I just texted Anita. I think she's in the room to tell her we can't hear them.
Okay.
So hopefully.
They can't hear us?
But we can hear them.
Check. Can you hear me? Checking 1, 2.
Oh, now we can hear you.
Check.
I can see it.
Okay. Did you hear my public announcement, my public safety announcement?
No.
Okay, so I'm going to say it again. COVID has affected all of us in some way, shape, or form in this country. So please encourage yourself, your neighbor, anybody that's watching this meeting to continue to social distance, wash your hands, wear a mask, and do what's right for your neighbor. And Mr. Beavis concurred with that.
I agree.
Thank you. Okay, Mr. Wheeler.
I'm sorry, because Steve brought it up. Can you just tell people what to do and what not to do for Thanksgiving? Because I'm hoping somebody picks up on that, because if you're going to pull 20 people into your house and you're all going to be using the same serving spoons, you need to be using disposable plates and disposable forks and knives, and then get a new one for your second round. Don't all sit around the TV. I mean,
yes, we can do that.
I mean, it needs to happen. There needs to be something that gets out there, because most of the people, whether you're in education or in business or anything else, we're scared to death about what's going to happen with Thanksgiving.
Yeah.
Because people are coming home and then they're going back out.
Right.
And that's going to compound this. So it may not be fun, but, zoom in those guests who are from out of state.
Right.
That kind of thing, So if you have any best practices, we got to push those.
Okay.
Thanks.
Tune in to the health department website, please, or Facebook page. Anything else, Mr. Beavis?
That's enough.
All right, yeah, go back to work, huh?
Okay.
Tell everybody at your department that we appreciate everything they're doing to try to avoid more cases.
Thank you.
And we understand how hard it is.
Keep up the good work.
Yeah.
Yeah, we're either the most famous people right now or the most infamous. I'm not sure. I'm getting both.
Do we have anything from Dr. Greg Murphy's from schools? Do we just got to approve his report? No report? Okay. Nothing from schools? Anything from the VAC? I don't see Karen. Is there a report we have to approve? Nothing for Karen. Okay. Moving on to our special guest, the county administrator, Anita Speckman. Come on down. Follow up. You want to not sit in that chair? You can sit in there. We can switch chairs. I should have brought my fogger.
Yeah, exactly.
Sorry.
Or my bleach bottle.
Right.
And following up, we do recommend all our employees have, bleach water near their desk. We're doing as much cleaning as we can. We still have Wes's guys coming twice a week and doing a deep cleaning day. When we identify a case in the building, Wes's group goes in and cleans the entire area and anywhere they might have been. We put up the plexiglass barriers on any of our forward-facing departments. All our employees must wear masks when they are unable to social distance. We are temperature testing every morning. We have closed the building unless somebody has an appointment, or downstairs if there's not an appointment, our door stewards are checking to see if they're able to social distance. So we continue to try to mitigate the risk here within you know, the county buildings where we have the ability to do that. But it's definitely here,
It's everywhere.
so.
Staffing report?
So staffing report, as you can see, there's really nothing really much to discuss. We had 3 people that were terminated, resigned, actually, all 3 of them, and 2 additions, 1 full-time, 1 part-time. Minimal change this month, so.
And there's normally not a change towards the end of the year, right?
It's usually pretty quiet as we get towards the holidays, yeah. So it typically stays like this until after January, so.
Any questions on the staffing report? Questions? Okay. Seeing none?
Couple things. The memo of understanding, last month I had brought for Mark Rogers, a memo of understanding that was drafted between Mark and his IUOE Local 150. There were some questions from this committee who requested it get sent back and made clearer and requested some changes. Mark, there was also some question as to what predicated the MOU, and so I asked Mark to be here and to explain that and kind of explain the process of where we're at. There was some concern that it hadn't been seen by the union or the state's attorney's office, so I asked Mark to speak to that as well. So Mark, if you want to talk a little bit about what predicated the drafting and what your process has been, that'd be great.
Sure, Anita, thank you. We've had, when this union contract was put together, I was not at the table during those negotiations, but the document was what it was. And we had an employee that was off for an extended period of time using his extended illness. But in one part of the contract, in order for the employee to receive all his vacation or sick time, there were specific hours that person had to work. And in that section, it did not include extended illness. So when the person was off for 2 months, basically they had no hours of work. So I dug deeper into the contract, and there was another section of the contract that said while a person is off on sick leave, that they shall still earn their vacation and sick time. So not wanting to have a grievance by denying this person their extended illness for the following year, I contacted the union. They drafted something, sent it back to me. I reviewed it. I sent it to the state's attorney's office. I believe Nancy reviewed it, and that's what was sent to the board originally. I think Anita took your suggestions, sent them back, and Nancy, correct me if I'm wrong, but I think that you rewrote that. We sent it to the union, they agreed, and this is what's before you today.
I didn't rewrite it, but I worked with Anita. She rewrote it, and then we worked on it together, though.
Okay, thank you.
Yes, Mr. Kinzinger, hold on one moment.
Thank you. The memorandum of understanding, I can understand it, so it's well done, thank you. My only question is this memorandum of understanding adds nothing to the contract that was negotiated. It only clarifies the contract that was negotiated.
That is correct.
Thank you.
That's correct.
Thank you.
Okay. Mr. Wheeler? Oh, yes, motion to approve. We need to, before we have some discussion. And a second by Mr. Payton, thank you. Now discussion. Mr. Hunter.
Yeah, good job, Anita, Nancy, really good job, really good job.
Any other discussion? Okay, I seeing none. Roll call vote.
Mr. Lear?
Aye.
Mr. Hess?
Aye.
Ms. Weber?
Aye.
Mr. Payton?
Aye.
Mr. Kinzinger?
Aye.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Hunter?
Aye.
Mr. Eads?
Aye.
Mr. Wheeler?
Aye.
Mr. Searoy?
Aye.
Motion carries.
Okay.
Thank you very much.
Okay.
Got anything else?
Yes,
Okay.
two other items. The first is I just want to let you know we are working, there are two labor contracts for the county that expire November 30th of 2020. There is a small negotiations group that is working on those. One is the maintenance department, the Teamsters, and the other is the lieutenants out at the sheriff's department, and that's with the FOP. I've talked to Sergeant or Chief McCabe on that one, but we're working through those together. So
Okay. Those are ongoing.
correct.
Do you have an idea when we might finalize those? Pressure?
Yes, I'd like to be optimistic and say that we're close,
Okay, good, good.
but one never knows.
Right. Awesome. Any other questions for Ms. Speckman?
I do. I have one question.
Sure, Mr. Hunter.
Yeah, Anita, thank you very much for giving pragmatic responses. I was wondering, in any of the contracts under our jurisdiction, does bilingual pay exist at all in any of those contracts?
No, not that I'm aware of. Not that I can say off the top of my head, no.
Okay.
Not
thank
that I'm
you.
aware of.
Okay.
Anything else?
I do have one last item.
Okay.
Okay.
Keep going, girl.
All right. All right. So the county has three optional 457B retirement plans available to our employees. One through Nationwide, one through Massachusetts Mutual, and one through Wachovia. As part of the CARE Act that was enacted back in April, allowances were made to allow withdrawals from 401ks, 403bs without penalties or tax implications to qualified employees. It is optional for an employer to opt in or to not accept these additional allowances. And what needs to happen is it's a COVID-related distribution, which allows employees to take money out of these retirement plans without.
We had another flash here. Pause, please. Jason?
We just had another power flicker.
Yeah. No, this is an action item. We'll have to put it on the agenda.
Correct, that's what I'm gonna get to.
Is the wind causing this?
I wanted to
Yeah.
tell you what I'm gonna do next
Okay.
and where
have to
we'll
opt
address
like the
it.
sales, like the
Right.
income tax.
Correct. Correct.
Where did they go?
I
Steve,
can see you.
You can still hear me, right?
Yep, I can.
See the boardroom. It looks like Jason's trying to
Yeah, I see him.
maybe do a patch through or something.
Check 1, 2.
Oh,
Check.
there he is.
Check 1,
Perfect.
2. We had another power flash here.
I got you.
And I'm sure it's the wind. So,
Here.
can you hear us now on Zoom? Thank you.
Yes.
Okay.
Okay, so I do want to clarify before I get too far into this and people start panicking before. I'm not asking for any decision or action today. I want to give you the information and we'll take action at a later date. So I'm aware of that. But I did want to at least make you aware of what has happened this week. So this week, an employee, actually their spouse, called and wanted to make a withdrawal under this as their spouse tested positive. We have not opted in. The board did not take that action previously. So I anticipate putting it before the full board at the meeting in December. The board can decide to either implement the additional allowances, not to implement the additional allowances, or to send it back to the December executive committee to be voted on in January. Be aware that the CARES Act ends December 30th, so the employees would need to take out the distribution before 12/31. However, it can be retroactively implemented. That comes from the IRS regulations as well, and I did work with the state's attorney's office as we reviewed the regulations for the allowances under the CARES Act. So that, I think, due to the timing and the fact that we have this employee's spouse who's calling us every day, we thought it would be good to put it, Nancy and I discussed putting it on the full board so that at least there's some action by the board in December.
I think we can move it to the December 8th board meeting and with discussion there. Okay, thank you.
But I did want to make you aware of that, so.
Okay.
Is there any other questions for me?
Anything else for Anita? No? Seeing none, thank you.
Okay.
Okay, moving on to administrative issues, appointments, reappointments, and resignations. We have the appointment of Craig Skosma to the Clausen Park Drainage District, appointment of Ralph Parberg to the Kankakee County Regional Planning Commission, appointment of Ruben Feliciano, I knew I would. That's going to be a blooper there.
We flickered
Feliciano. Hope they cut that one out.
I'll get this meeting over before we can't close it.
Could he, Mr. Chairman, could you repeat what you said?
Yeah, I will not.
I think we lost him again, Steve.
It appears Jason's trying to rehook everything again. Every time there's that flash or that happens, Jason has to come out and rehook things up.
Okay.
Check, 1, 2, check.
Gotcha, Ted.
All right.
You're back.
Appointment of Ruben Feliciano to the Kankakee County Regional Planning Commission. Reappointment of Maurice Manuel to the Kankakee County Regional Planning Commission, and appointment of Michael Maloney to the Kankakee County Regional Planning Commission. I need a motion to approve, Mr. Hess and Mr. Lear. Thank you. Roll call vote, please. Or do you have any discussion on this? I hope not. Thank you.
Mr. Lear?
Aye.
Mr. Hess?
Aye.
Ms. Weber?
Aye.
Mr. Payton?
Aye.
Mr. Kinzinger?
Aye.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Hunter?
Aye.
Mr. Eads?
Aye.
Mr. Wheeler? Mr. Searoy?
Aye.
Motion carries.
That's what I get for not wearing my glasses today. 3 openings on the Mantino 9 Drainage District. 1 opening on the Moments and Yellowhead Drainage District number 1. 3 openings on the Moments Pembroke Unage Drainage District number 1. 1 opening on the Raymond Drainage District. 1 opening on the Spring Creek Drainage District. 1 opening on the Union Drainage District number 2. 1 opening on the Yellowhead and Washington Union Drainage District number 2. 8 openings on the Kankakee County Regional Planning Commission. I don't think there's 8 now. Is there 8?
There's 12.
Okay. Okay. And then 1 opening on the Essex Township Fire Protection District and 1 opening on the Kankakee Township Fire Protection District. So if you know anybody interested in those, they can apply through the county board's website. There's applications there. And then moving on to new business, reauthorizing the county board chairman to sign an agreement with the Economic Alliance. Can I get a motion? Mr. Kinzinger, and seconded by Mr. Payton. Now discussion. Anyone have any discussion? This is a 2-year reauthorization. It was discussed in PZA yesterday and now moves on for our approval to go in front of the full board. Any questions? Questions? Roll call, please.
Mr. Lear?
Aye.
Mr. Hess?
Aye.
Ms. Weber?
Aye.
Mr. Payton?
Aye.
Mr. Kinzinger?
Aye.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Miller,
Aye.
Mr. Hunter,
Aye.
Mr. Eads, Mr. Wheeler, Mr. Searoy.
Aye.
Motion carries.
Is there any old business to come before the committee? Any old business? Any other business? Mr. Hess? Okay, have a second? Mr. Eads. All right. All in favor of adjournment, say aye.
Aye.
Have a good day, everybody. Stay tuned for the